Joining us now are Dr. Wharton, who specializes in bariatric medicine and diabetes treatment, and Tim Caufield, a professor at the University of Alberta, who specializes in legal and ethical issues in medicine. Good to see the both of you. Dr. Wharton, we'll start with you. To be transparent, we should say you were once a spokesperson for the company that makes Ozempic. What are these drugs supposed to be used for, and what is it about them that makes them useful for other purposes?
And so these drugs are type 2 diabetes drugs, but that means they work in the peripheral part of the body. So they go to the pancreas and to the gut, and they work there. But they also work in the brain. And the brain is what controls our eating behaviors. So if somebody is excessively eating or has excessive hunger or is trying to get the weight down, but they're not using their fat stores for their energy needs and they want to eat more, this dampens it and quiets it down so that you can actually use your fat stores for your energy and not eat extra food so you can lose weight.
Okay, got it. Tim, there's a lot of hype, right, about these drugs and their off-label use. Is it overstated? Are they being marketed responsibly?
Wow, there is an incredible amount of hype about these drugs. And, and I think it's fair to say that there's growing concern about how they're being used. Yeah, look, the off-label use is what's getting the headlines. And of course, what we're talking about here is weight loss. And the concern is that people are using this for kind of vanity weight loss, not for the clinical need that the drug has been designed for. And there is a lot of hype, not just coming from the manufacturers, but of course from the social media influencers too. And the message there, again, is often weight loss for kind of the wrong reasons. And as our medical expert will tell you, there are concerns with this drug.
I have been hearing about those side effects and the long-term effects. Dr. Wharton, though, do you think there are ethical concerns with how the drugs are being marketed?
Well, I'm not sure that there are concerns with the way that the pharmaceutical company is actually marketing it. It's more so a lot about the social media. So I did a lot of the research for the way that these medications work. Obesity is a real disease. If you're living with obesity, you've been looking for an answer to your disease. And this is it. These medications are actually here. They actually work. It's a big deal. It's a breakthrough. Now, when it comes to using this for the aesthetic purposes, if you need to lose 5 pounds, this has never been studied with someone with a low BMI and who needs to lose 5 pounds or get to a wedding. Not the people that we did the research in, not the indication for the actual drug. So I do have a big problem with it being used for a aesthetic purpose. It's off-label. It's not what it's approved in Canada for. It's approved for obesity treatment, and that is a real illness.
And Tim, what about those people who these drugs are intended for, people with diabetes, like Dr. Wharton is saying? What is the concern for them?
Well, you've probably heard this. There's been headlines about this also. There's concern about supply, about not being able to access the drug. There's also concern that this drug is not being allocated in an appropriate manner. Look, I even know anecdotally from my colleagues that are healthcare professionals, including my wife, that patients are coming and asking for this all the time. The hype is just unbelievable, and so demand for this drug is having an impact on the healthcare applications for which this drug was designed.
Are you seeing that, Dr. Wharton? What are you seeing in your practice with patients using these drugs and who want these drugs?
Yeah, so my practice is specifically for people living with type 2 diabetes and living with obesity. Everybody that walks in the door is a candidate for this medication because they have the disease. Now, if it's being used in a aesthetic manner, I don't know where they're getting it from or how they're actually getting it because you can't prescribe it if the indication isn't actually there. So this hype is a lot of American hype, but will it come to Canada? Probably. And does it work? Yeah. If you want to lose 10 pounds, it does work. The drug doesn't care whether you're 450 pounds or you're 150 trying to get down to 140 pounds. But the question is should it be used in these people when there is a supply problem? And how are they getting it? And are there side effects? And is the risk-benefit worth it for somebody who wants to lose 5 pounds?
Tim, when it comes to metformin, people are suggesting all kinds of benefits that sound really far-fetched. Cancer prevention, for one, you can get smarter, longer life. Is there truth to that?
Well, it's a very interesting drug because there is real research that shows interesting application. And by the way, it's a drug that's been around for decades, for a very, very long time, again, being used to treat primarily type 2 diabetes. And again, that's where most of the clinical research resides. But there has been animal studies in worms and mice that suggest all these other potential benefits. And what we're seeing is the longevity movement, which I think is almost like the new wellness woo movement that we're seeing. The tech bro industry is kind of really, really embracing this with the idea that you should be taking it when you're asymptomatic, sort of on a preventative, for preventative reasons to increase your lifespan, and we just don't have good data to back that up yet. Look, interesting research is going on, but we don't have data to back that up. And by the way, I do think it's ironic that we have the lowest life expectancy in the United States since the last 25 years. Meantime, all these billionaires are taking this drug to extend their life. I think it's quite ironic.
Something doesn't add up. Dr. Wharton, what do you think about that? And sort of, metformin has been around, but that people are now talking about it and talking about using it for other things.
So the question is where did this research come from that goes beyond type 2 diabetes? It's epidemiological retrospective research that somehow shows that these patients tend to do better in terms of their longevity and their cancer risk, but it's confounded with a lot of different challenges. The people who are taking metformin versus the other medications may have been a different group of patients. This is not data that tells us we should use it in a prospective manner in people who are looking to live longer or looking to deal with their cancer treatment. We need real research, the way Tim said, and there is real research that is going on. So we've been informed, there's some interest, it looks like it could be something, but we can't run out and start using it without actual data.
Thanks for breaking it down for us. Dr. Wharton, Tim Caufield, thank you.
Thank you.
Thank you.